I am grateful to talk to you about why it's important to ensure that folks, residents that we are fortunate to serve, get access to flu shots. This bill, as you heard, does not require one. I want to say what the bill doesn't quickly, and then I'll talk about why it's important. What it doesn't do is it doesn't require one to get a flu shot. It doesn't require one to access, or for a caregiver to require one to get a flu shot. But what it does provide is an opportunity and an option to get a flu shot and to be offered one while one is currently in the hospital and prior to discharge. And this is why it's important. We've seen an uptick right now. The rates for flu in Washington and national are alarmingly high. In December, at the end of December, the latest numbers, 22 Washingtonians had died. Outpatient visits, we've had 10,000 folks, and from November, for folks impacted, seriously impacted by the flu, in outpatient visits, it went from 1.4%, or sorry, less than 1% in November to 3.4% now. And so we see continuously to see these rises of rates, and providing access while one is in the hospital to those who are 65 and older and to those with chronic health conditions is important because it gives them that access point where they can do that. The economic impact for folks who don't have access to getting a flu shot, again, as their choice, it's a choice to get one, is significant. Not only is it time away from work for themselves or from school, and many days lost. It's time away from work for caregivers who are providing that access. It's a cost to hospitals when one has an opportunity to get a flu shot. They're less likely to come back and spend many days who may not have insurance or be able to afford the costs, and may increase costs of charity care. And it's an economic impact for our small businesses who need workers to show up to work, and reducing those days and those hours that they're missing because they were sick is problematic, and certainly an economic impact on their businesses and on our economy. And so for all of those reasons, it's really important. The data bears witness to this. This is patterned after many states who have adopted this very similar bill, a very limited, targeted population, and I'm grateful to those states who have passed it in this manner. Again, it's for those who are 65 and older, for those with chronic health conditions, children included, to be able to ensure that they have access points, expanded access points across Washington, rural and suburban and urban, to be able to get a flu shot if they so choose. And so we've seen the evidence, and the data bears out that it's been proven to assist to keep our communities safe and healthy, and urging your body to move it forward, and happy to answer any questions. I will say that I'm also grateful to the Hospital Association. They've been really good to work with and have given some really sage feedback that you'll hear about, that I've accepted in amendments that will be coming forward, and so grateful for their work on this bill as well. Thank you.